Tonight's top story, while the pandemic might not be in hindsight, there are still some lingering effects we're seeing 3 years later. One of those being supply and demand shortages, especially when it comes to certain essentials. Thank you for joining us. I'm Jamie Baker.
And I'm Dylan Cleveland. News 9's Chloe Messagaitis worked to learn more from healthcare professionals and has the entire story.
There is definitely not enough to go around, and it's having to be rationed.
In recent months, it's been harder to get your hands on medications like these. So are we feeling the sting locally, and what's being done to lessen the burden?
The answer is yes, as that seems to be the thoughts of many, just like pharmacist and pharmacy owner J.J. Barnaby, who says these shortages are the worst he's seen in a decade. Medications for ADHD, diabetes, and just overall pain meds are some of the most in demand, as there's a waiting list for many of them.
We're monitoring the availability through all of our sources daily, first thing in the morning, late at night, on weekends. As soon as it becomes available, we purchase what we can. A lot of it is allocated.
And now some clinics like the Ohio Valley Health Center, which provides free care to the community, are getting hit as a result. Executive Director Ann Quillen says it's been most difficult for their uninsured patients.
People who have a chronic disease such as diabetes or hypertension, those folks are the ones that we are having a hard time getting medications for.
So where is a lot of this stemming from? Well, like everything else, it's supply and demand, which brings other details into focus. As pharmaceutical company Pfizer's plant was destroyed from a tornado, and generic drug producer Teva closed its doors.
Created all kinds of shortages in the retail market, in the hospital market.
Quillen says for 17 years they've always had access to certain meds, but that's not the case now.
We have had to purchase those medications for the first time because of the lack of access through the pharmaceutical companies.
But it's a waiting game, as no magic pill can be taken to lessen this kind of pain.
Really, you got to stay on top of it, work with your pharmacist, work with your doctor, and try to find out when it's available and try to stay stocked up.
And while this may be a minor setback for the healthcare field, they say they will continue to work their hardest to have these medications available for all patients. For News 9, I'm Chloe Messagaitis.
I'm Gianna Dupre. Thank you for watching. Here's another video for you to watch, and please take some time to subscribe to our channel.